speaker is not, camera is not working. Thank you very much for joining us in our 1914th webinar, Rural Health Services, the Challenges. Thank you very much for joining again on 1914 series or episode or whatever you can say, webinar, conference. But we are grateful to you, speakers. Madam Sanyal Mukherjee has joined us. Thank you very much, Madam Mukherjee. And I would like to request Professor V.K. Agnihotri sir to bless us on the topic and invite Dr. Suparna Sanyal Mukherjee.
Thank you, sir. Thank you, Professor Pawan Sharma-ji. It's a pleasure to be here again with a new topic of today's evening webinar based on the rural health services. As we know, before 30 years since today, the population configuration of our country was more in villages and lesser in our country and our urban areas, 75-25 like that. Here, now the changes have come. It is now almost 65 to 70 in rural area, and rest of the persons are rushing to the urbanization formula and urban country cities. Fact is, we are taught always that Bharat गांव में बसता है, भारत ग्राम प्रधान देश है, कृषि प्रधान देश है and all. बट उस कृषि प्रधान देश और गांव में बसने वाले भारत के जनसंख्या के स्वास्थ्य की सुविधाएं उतनी अच्छी नहीं रही जितनी की होनी चाहिए, जबकि उन्हें अधिक स्वस्थ रहना पड़ता है खाद्यान्न उत्पादन के लिए, पशुधन की सेवा शुश्रूषा के लिए और उन सब फैसिलिटीज के लिए जो आज भारत का अर्बन एरिया का या शहरी क्षेत्र का इंसान रहता है और कुछ सुविधाओं के अभाव में वो बाहर भाग के अर्बनाइजेशन के नाते बाहर आना चाहता है और आ रहा है। तो ऐसी स्थिति में गवर्नमेंट ऑफ इंडिया और WHO के रूलिंग और डायरेक्शन के अनुसार ये आवश्यक बना कि हम ऐसी स्वास्थ्य व्यवस्था दें, किसी भी पैथी की, एलोपैथी की हो, आयुर्वेद की हो, यूनानी सिद्धा की हो, कि वो गांव वालों को भी रूरल एरियाज में भी और सब अर्बन एरियाज में भी ये सुविधाएं मिल सके। इसी क्रम में जो NRHM जैसे प्रोजेक्ट चलाई गई, जहाँ पर देखा गया कि हम रूरल हेल्थ की स्कीम्स के अंतर्गत गाँव वासियों को भी उनके ही निवास स्थान, उनके ही विलेज में और इर्द गिर्द के विलेजेस में दे सकें। और हमने पाया कि पिछले 40 वर्षों में 10,000 की पॉपुलेशन पे SAD स्टेट आयुर्वेदिक डिस्पेंसरी बनी और 25,000 की पॉपुलेशन पर प्राइमरी हेल्थ सेंटर और उससे आगे पर 1 लाख पर अपग्रेडेड प्राइमरी हेल्थ सेंटर लाइक बना। तो उसमें हम क्या कुछ दे पा रहे हैं, गवर्नमेंट ऑफ इंडिया, स्टेट गवर्नमेंट्स, डिस्ट्रिक्ट लेवल पर, CMOs के लेवल पर क्या कुछ हेल्प हो पा रही है और कैसे हम रूरल हेल्थ पर और अधिक सेवाएं दे सकते हैं। इस सब के लिए आज की हमारी प्रखर वक्ता गेस्ट स्पीकर हमारी डॉक्टर सुपर्णा सन्याल मुखर्जी जी हैं। हम उनका बहुत बहुत स्वागत करते हैं और मैडम से निवेदन करते हैं कि वो इस टॉपिक पर अपनी विचारधारा प्रस्तुत करने के पा करें और थोड़ा अपडेट भी करें कि अभी के क्षेत्र में भारत में स्टेट वाइज स्टेटस क्या है, कौन सा हमारा प्रदेश आगे इसमें अच्छे बढ़ के काम कर रहा है और किन क्षेत्रों में, किन प्रदेशों में और अधिक इस दिशा में काम होने की आवश्यकता है। आपका बहुत बहुत स्वागत है। नमस्कार।
Thank you very much. Thank you very much once again for giving me another opportunity to say something on this auspicious platform. The rural health is a basically very important sector, rural health system in India. Rural health system in India is also encompassing the two factors: how the health system will be managed in the rural area. So if we can emphasize, there are two processes. One is the primary health center, another one is the community health center. In that case, if we can observe that it is a last 2011 census, it has been measured, and it has been rectified, and exhibits that the 1,40,124 sub-centers has been established, of which the 23,887 is the primary health center, and another one is the 4,809 is community health center, which has been incorporated in the Indian rural system. So in that cases, how the rural health has been rectified, and how the rural health has been looked after in the center concerned. If we can go to the deep interior of the forest and the community village, or the village forest, protected forest, though in case of this the reserve forest, there is no center you will find. But in case of the protected forest and the village forest, you can get the primary health center, and this primary health center, the all facilities you would not get it, because there are very less fertilizers, and the number of doctors is very less, and the centers, there is no sub kind of members you will found it out, because the doctors is not interested to go serve in the rural areas. So this rural areas is very dangerous situation. They are suffering, they are suffocating, because the health system is absolutely very bad, because the persons are not getting any kind of the treatment. They are also suffering from this various types of diseases, because those diseases they are not been aware, the rural people are not been aware, still they are suffering from. Because the community health center also is a system where the persons, the rural, absolutely adjacent of the forest, and the same time the deep inside the forest, those who are living in the rural sector, there is a community health center may develop, but it is a very dangerous situation, and it's a burning topic. It's nowadays in this Indian subcontinent, especially the immunization system, the nutrition system, the children, especially the neonatal care, they are suffering from this malnutrition. The immunization system is very bad. So that's why the people are suffering. So especially the children are suffering from diarrhea, pneumonia, and some kind of this very ailment. Also they are suffering from, because they are not taken care of. Though we have made our Indian subcontinent, at the same time our world is a polio free world, so they are not suffering from this polio, but they are suffering from neonatal diseases, which is not curable, and there is no prevention measures are taken care of in this rural area. So if we can see this, the primary health center taking care of you, and there is a system which is generated by the primary health center, and we are also giving some name like the super specialty primary health center, but the facilities are there is no facilities. So what is happening? So the person, those who are also engaged in this rural program through this the national Mahatma Gandhi National Rural Employment Program, they are getting this 174 to now this 184 crores, but their employment opportunity is only for 100 days. It is employment. What will they will get employment for 365 days, 100 days, and 365 days is not the covering. So what they will get, they are not getting any kind of health facilities, because rural health is absolutely bad. And in case of this children, when they are going to the school, there is so many requirements, there are so many formalities in the bulletins. You will get the midday meal, you will get the iron tablets, you will get the proper education, you will get the healthy situation, you will get the good sanitization, but nothing you will get living on that particular place. So why, how the people, the Indian subcontinent people will be survived? because these people are absolutely innocent. They don't know, they don't have education, they don't understand any kinds of development, the modernity. So they are fearing, they are very shy in their nature. Whatever they are getting their health system, only here the Ayush is the Ayush can enrich those people. They know that they are the rural people and the medicine doctor. They know which kind of leaves are better for their good health, which can leaves can give them the protection, which the stem can give them the protection. They are practicing Ayush. The Ayush medicine is very important to them, because without Ayush they cannot survive, because whatever has happened to them, it is not possible by them to buy the any single medicine from this market, because they are below poverty line. So though they have the job card, though they have the all the facilities which has been provided by the governments, but when they are going to the shop, the 2 rupees kgs rice they wanted to go to bring it from their home, but they are not getting. So this is the situation, this rural situation absolutely broken down. So we are not taking care of, we are telling this, we are making this global village, we are making this eco village, we are providing all the facilities to the community development, the community health center. There is nothing, no way, not necessary. If the doctors is not wanted to go to the rural mass to give this and give their service, so it is a very very dangerous situation, because all the doctors, they are thinking then how much money we had been input, we want the output. There is no sacrifice, there is no system, there is no conception, there is no ethical point, there is no value education, because we always think for our betterment, we never ever think for the others. But in the society which has been formed by ourselves, so we are taking care. If we can take care of myself, so we should be take care of yourself too, because this is our moral responsibility. But there is no moralities of that cases. We can say that the primary health center, there is no system has been oriented, though there is all the rules, regulations and facilities are there, but it is not been practices. And the community health center is also is suffering from the all kinds of lack of medicines, lack of doctors, lack of nurses. There is nothing. And the sub centers, when the people are going to the sub centers, they are also not getting the proper medicine, so they have to come to the urbanized area, so where the facilities are there, where the big doctors are there, where the money is needed, where you can emphasize yourself, you can put your money and you can get the service. So this is the system we are not practicing it to in case of the Indian knowledge system, we can emphasize that Shushrutra is the father of surgery. If we can go to the surgical process, that we are following the Shushrutra's rule, which can enregistered through this Ayush system. So we need the before going to the medicine, joint entrance examination, or the doctors when they are entering into their, curriculum, course curriculum, they should know the moral education. They should be treated as that when they are taking oath, they should service first to the rural area. Then only we can encourage and enrich the rural people and rural health center, which is needed for us, because the rural mass is also a fellow citizen of us. At the same time, if we can look into the urban health center and urban facilities, so all are related with these urban facilities, and there is a too much competition. So if we can avoid this competition, we can go to the rural, because rural mass are also a mass who are needed the facilities, the health facilities, and it is needed for us for the betterment of the nation and to give birth of the good and healthy nation. It is a requirement for us. So in that cases, the Ayush has the very good platform for this rural health center to practice the rural health center and to provide the indigenous knowledge and indigenous technology and indigenous way of medicinal aspects. So the people, those who are living in the rural area, they don't need to go to the urban area. They can enrich themselves, and each and every block and each and every village there should be a Ayush center. This Ayush center can give them the potentiality, the support, then we can enrich the Ayush in the rural area, and the rural health center should be very good than the urban areas if the Ayush can take the initiative for development of a Ayush rural center, the Ayush health center. So this is my foresee, and I can see that if the Ayush can develop, so there is a miracle can happen in this rural area and rural health sector. Thank you very much. Thanks to giving me such an opportunity. Thanks.
Thank you, ma'am. Thank you so much. You just pointed out so many very, very important points which are related to the rural health services. And what I infer that in rural health services or under the heading of primary health center services or primary health centers or community centers, we are not literally we are not only dealing with the health problem of the rural population. This center or these services are also related with the availability of the milk hygiene, education, source of amusement, shelter, each and everything which is supposed to be there for a living human being. It is also to be taken care of, and especially when you told that doctors are not interested to go to the villages, they are deprived of that one, and you see what may be the situation like Uttarakhand, that not only the rural services but also at the far off places services at hills, it becomes automatically much more, say, full of crisis that they are not so much available. Now they are being enforced to be available with the help of the bio means attendance and all that. So the fact is that if the rural population will be taken care of properly on the all aspects like education, e-bills, nutrition, and the health services, definitely our villages will be healthy, and then of course the healthy persons who are living in urban areas may also be getting the good backup for their bread and butter. Thank you so much. It's really a pleasure to be here to listen from you. Thank you so much. Now, in this connection, I would like to welcome first Dr. Shaikat Kumar Basuji, and then I would like to invite him also because he is also a great center of knowledge and having practical experiences also that a crowded area like Kolkata and also abroad cities, there used to be such type of problem that rural health, how it can be executed with the help of the say qualified doctors, pharmacists, nurses, and supportive staff with the help of the along with the medicines. So I invite Dr. Saket Kumar Basuji. Please present your very important.
Thank you.
Namaskar.
Thank you again,
Thank you.
Yodhiji. Can you hear me? Actually, I'm in
Yeah,
Bhubaneswar today
sure,
attending the conference.
Very clear.
So sometimes I may have a little internet disruption, but nonetheless, thank you very much. It's a very important topic. And I am not sure if the internet will get disrupted. So I'm getting straight to the point. So I think I listened to Madam, and I think she has raised very important points and strategies that is essential. The United Nations and the World Health Organizations have very clearly mentioned that in highly populous countries of Asia, Africa, Latin America, and particularly countries such as India, China, no matter how much healthcare facilities are developed by the government and non-government agencies as well as private sector, the allopathic medication care is not so easy to be transferred to every remote corner of the country, while every citizen of the country deserves to get some medical support and help for their natural treatments and stuff. The other important thing to understand is that that in our daily life we do not need brain surgery, or a liver surgery, or a kidney transplantation, or rare very serious surgical or very serious neuroscience related disorders or nerve disorder that would need high level surgery, high level medical inputs from modern science or modern medical sciences. Most of the time our common problems are catching common cold, not feeling well, health style related diseases, disruption, stomach upsets, and those kind of stuff. And these general health that we are the very basics. And if they are not taken care of at a very early stage, and if they are untreated and they do not get the medical care, these things leads to further complications down in the line. Now, in many rural parts and many, significant border areas, remote rural areas, where there are not proper medical facilities, where many tribal communities are dependent on the tribal medicine men and other such resources for their medical treatment, I think Ayush has wonderful opportunity, not only with respect to Ayurveda, homeopathic, Unani, Siddha, all these alternative health systems that we have could be easily established, and the health facilities could be extended with the help of experienced doctors, nurses, and assistants towards these rural areas. Because sometimes we do not even need to deal with very complicated situations. These are major health supportive food supplements, better health care, education and awareness, and general health, which could be easily handled with many of these holistic healthcare that we have in our system, that not only provides employment for a large number of personnel who are getting into the Ayurveda and other holistic or the Ayush system of medication, as also it extends the medical services to bridge far and wide areas where no proper medical facilities could be extended. At least there is some primary health care that could be established, and over the time, as the Ayush facilities get strengthened, down the line these things could be improved and better healthcare could be easily generated. I think it is important for the government, the central and state governments, union territories, as well as the local governments at the gram panchayati level, Panchayati Raj, Palika Raj, for them to understand that it is very important to establish some sort of healthcare facilities for the people, where advanced medical healthcare or surgery interventions or proper high level medication, etc., is not available, or the government is not being able to establish. I do not see that there is any challenge in establishing these alternative healthcare systems in those particular areas, so that the people have at least a basic primary healthcare. And the basic, little bit of vaccination and other facilities could be extended through these Ayush centers too. So it is unfortunate that in spite of the potentials that we have, there is a lack of political will, actually, I feel, in propagating these medical systems throughout this particular part. And the other part is also that, like, various sections of the allopathic medical care, Indian Medical Association, and various other associates, the doctors are not ready, like those who are trained in allopathic are not ready to visit the medical centers in remote rural areas, because they have better opportunities and career in the cities. But at the same time, they will put up protest or politically motivated approaches, so that no such Ayush healthcare is also being established. So they are not providing the medical healthcare that is necessary, but they are also doing political stuff, so that no healthcare in the alternative healthcare system is established in areas where modern healthcare is not available, because of the remoteness, because of their access, because of their location, because of the poor infrastructure, the roads and stuff, where it is very difficult for people to establish a modern hospitals and something like that. This is something where our parliamentarians and our lawmakers, strategists, as well as medical personnel from all the fraternities, need to come together on a common platform and think about that, how, rather than fighting with one another and putting a roda, I would say, in each other's step, it is important that we could cooperate, so that all this health system could coexist and it could complement with one another. When there is very serious need of surgery and other related modern medical interventions, they could be referred to city hospitals and city government facilities and stuff. But for the very basic things such as stomach pain, flatulence, or running stomach, diarrhea, or headache, or common cold and cough, fever. For those, if cares are not taken at the right moment, this will expand and impact the health down the line. This is very, very strange that even 75 years post independence, the government is struggling to do this. My personal feeling is that there is lack of political will in doing this. Also, I think on these particular juncture and venture, our alternative healthcare systems or the Ayush medical practitioners, whether they are from the Ayurveda fraternity or homeopathy, Unani, Siddha, everyone needs to come together and form a common strong platform advocating to the government, putting pressure on the government, putting pressure on the parliamentarians to take decisions, the state medical boards and central medical boards to come across and take strategies to help in establishing Ayush centers in remote rural areas or in rural areas where we are not the where the center of the state is not being able to establish advanced medical care system. So this is something where Ayurveda doctors and their fraternity members and other associations needs to come together on a common platform. I think there is this gap, there is this difference of opinion, and there is this lack of support even within the Ayurveda and Ayush fraternity in helping and supporting one another so that we could come together and establish this platform and help and push the government to take active steps in helping and establishing and changing the rural frontiers. I think, as Madam has very nicely illustrated, that if Ayush facilities could be established in and around the rural areas, this could transform the Indian healthcare systems drastically. And what is more important, there is tremendous pressure on the government healthcare system, both in the urban and rural areas, by promoting Ayush-based healthcare and by promoting Ayush health centers. We could reduce the pressure allopathic health government doctors. There is enormous pressure on the specialized, highly specialized, super specialty government hospitals because they cater to a vast number of the poor who cannot go to the nursing home, who cannot take very costly, expensive other alternative medical healthcare system that has developed, or the private healthcare system. They are dependent on the government system, but there is too much pressure on this system. So for complicated cases, for allopathic medications to give better facilities, they could easily do away with the OPDs of very simple, gastritis, gastritis, like cough, long term treated very effectively in the Ayush platform. So I think there needs to be talk, there needs to be communication, there needs to be several rounds of discussion, and there needs to be several on the various levels of government to take active initiatives in establishing extensive Ayush center healthcare system throughout the rural areas. And if it is established successfully in the rural areas, it will come up in the down in the line in the urban areas too. But there are vested interests of many organizations, many pharmaceutical companies do not want Ayush systems to be well established in the rural centers. So they have much greater political influence and clocks to prevent these from happening. So with this, I conclude my presentation. I think this was a very important topic that we need to look and reflect into our rural areas for better implementation of the Ayush system that can, as Madam has mentioned, that can revolutionize Indian healthcare system, and the entire Indian healthcare system could be a global model. It could serve as a model for the entire world. So thank you again, once again, Agnihotriji, Sharma ji. Thanks very much. And I am happy that I was able to deliver this presentation because today I am in Bhubaneswar. I am talking from my hotel
Oh,
because I'm attending a conference down there. I'm here as a resource person, but the internet has been disrupting a lot, and there is some kind of festival going on here. So there is
hmm.
crackers every few seconds with deafening noise. So I'm happy that I was able to complete it within time. Thank you so much.
No
Thank you.
problem. You were very much audible, and your presentation is wonderful. What points both of you raised is very very important, because we feel that we all are either the provider of the health services or the receiver of the health services throughout India. I think throughout world. So in that way, we are always coming across with such type of situation. But really appreciated by you that this is the Ayush graduates and postgraduates. They are always interested to get their even appointment in the rural areas or the foremost areas of our hill areas, and they walk on foot, say covering 5 kilometers or 10 kilometers to visit a patient at their end, or getting the use of cycle even where the other source of vehicles are not there. So in that way, no doubt, our ICE system graduates, they are committed enough to provide the services and to see that their wellness is very important. And now the government has, the attraction of government is also being sought for the upliftment of the rural say population. That's why the searching, researching, and then NRHM, say doctors and pharmacists and A&M, they are all playing their role with full responsibility to take up their say wellness of the rural population. So this topic is very important topic, and the scenario is changing for last 10 years or so. Otherwise, it was a worse condition. Persons are not getting the proper health services, and the government medicines are also not much more
Absolutely right. Absolutely
yeah.
right.
Yeah, because I had been there in posted as a medical officer way back in 1986, and hardly 600 rupees this petty, this say petty of this medicines were available for 6 months. It was always hard time to deal with the patients, and they are also not having enough money to purchase from outside, and the medical stores and Ayurvedic stores are also not there. So now things are much more changed. Even the furniture, the curtains, the tables, everything is now good. So thank you so much for your contribution on our platform with this very, very, very important topic. Thank you so much.
थैंक यू शेखर जी, थैंक यू वेरी मच। आज मैं झांसी में हूँ, कल ग्वालियर में रहूंगा। कल 3 बजे हाइब्रिड कॉन्फ्रेंस एक रखी है ग्वालियर का, मैं स्टेटस एंड स्कोप ऑफ आयुर्वेदा, ये विश्व आयुर्वेद परिषद मध्य प्रदेश के साथ में रखी है। तो मैं प्रार्थना करूंगा, जरूर जुड़े। थैंक यू सर, थैंक यू वेरी मच।
थैंक यू सभी को नमस्कार, शुभ रात्रि, नमस्कार, शुभ रात्रि, गुड नाइट।